All right. You're still muted, I think.
How's it now?
Perfect.
All right, let's go ahead and begin. As you know, I'm Dr. Will Nettleton, Medical Director, Kalamazoo, Calhoun Counties. This video is for our clinical staff at Calhoun and Kalamazoo Counties. This is a very brief overview of the standing order for the Pfizer vaccine, and also just very briefly, broad overview of how to identify anaphylaxis, severe allergic reaction, and basic management. I want you to refer to your nurse supervisor for the details and knowing where your go bag is, and also, again, review the standing order for anaphylaxis at each department as well. But I want to just share with that concern about severe allergic reaction and anaphylaxis. There's 43,000 people that were part of the trial for the Pfizer vaccine, half of which got the vaccine. In that 21,000 people, this effect was not observed. The effects where this is being seen is where it's now being used out in the community. So it's a rare event, but it's something we should be prepared for. And that's what this video is all about. So I want to just briefly kind of walk us through the standing order that you'll be receiving and observe. Okay, so you should be able to see my standing order here. So those who are eligible are those 16 years and older. And really the only contraindication is known history of severe allergic reaction, such as anaphylaxis, to the actual vaccine. I have a specific part that has a vaccine ingredients if those questions come up. So let's go over the precautions, and this should be considered as when you're doing the evaluation for who is eligible for the vaccine when they present to clinic. So moderate to severe acute illness, standard for most vaccinations. History of severe allergic reaction like anaphylaxis to any other vaccine or injectable therapy. IM, IV, or subcutaneous, we're gonna look at that. There's a specific table I have for that. So let's go ahead and kind of zoom kind of where that can be seen. So you can see the star here. If you zoom down to the last page of the appendix of triaging persons presenting for the Pfizer vaccination. So you can see some of these are part of a risk assessment. And there is may proceed with vaccination, precaution, and then contraindication. So you're probably gonna get a lot of questions about immunocompromising conditions, pregnancy, and lactation. And so this is really based on the clinical considerations document, which is referenced in the actual standing order. And so with respect to immunocompromising conditions, probably the main concern is that there's gonna be less effect of the vaccine because a person's immune system is low and not able to produce that immune response. So that's kind of the thinking about immunocompromised conditions. Folks can get vaccinated. Pregnancy, as I mentioned kind of in that video, it hasn't been studied in pregnancy or lactating women. So we don't know the safety and efficacy profile of this in that population. However, this is not a live vaccine like MMR, like chickenpox, which were to be more concerned. So this is really thinking about a person's risk factors. This is how to counsel and say, do you work in the healthcare profession or public health? Are you exposed to a lot of people? Are you in a high prevalence environment like you are in Calhoun right now or in Kalamazoo? And then assessing that risk with knowing that, hey, if you get pregnant while having COVID or COVID while pregnant, that you're at higher risk for medical complications. So it's weighing those risks and benefits, and that same true is for lactation. There's not a theoretical risk for or harming the baby with lactation. It's just that we don't have evidence for it. The mRNA in itself doesn't last that long. That's why it has to be kept very cool or very cold, I should say. And so that's the way to help think about those folks. It's really about offering it to these populations. It's not a contraindication. You may proceed. And so that's what this is kind of all about, this whole graphic here. But to the point about precaution. So these are folks coming down here, precaution of vaccination, history of severe allergic reaction to another vaccine, history of severe allergic reaction to an injectable therapy. You can still receive the vaccine, but there is that risk assessment. And it's really counseling the patient about the unknown risk of developing a severe allergic reaction and balancing those risks against the benefits of the vaccination. That's what we really got to help our community members and patients walk through. And these are fine to ask your primary care doctor these questions prior to be vaccinated. However, please note it is not a requirement or a prerequisite to have that conversation before being vaccinated. Those who come can present. And again, here are the actions to take as it's lined out in the standing order after that risk assessment of how long to observe those individuals. So 30 minutes observation period with a history of severe allergic reaction due to any cause, 15 minutes for those who are the general population or have a history of allergic reaction but not anaphylaxis. So please refer to this table when helping our patients make those decisions about being vaccinated. Avoid co-administering with another vaccine. Avoid administering 14 days before and after other vaccines. That's just because it hasn't been studied in that context. Consider deferring the vaccination for 90 days after receiving passive antibody therapy, the monoclonal antibody therapy to treat COVID-19. That's just some theoretical risk as we don't know the interaction. The antibodies still may be in there, may be doing its job. So the recommendation is to at least defer. It's not a contraindication, but defer until 90 days after receiving that therapy. We kind of already went over immunocompromised persons. So you can refer to this document for storage and handling, the FDA EUA. As you know, this is IM, 21 days apart, grace period 4 days before. So doses between 17 and 21 are valid. The second dose, if it's given prior to 17 for whatever reason, it doesn't need to be repeated. If it's more than 21 days after the first dose, give that second dose at the earliest opportunity. And as you all know, you can only stick with the vaccine that you start with to complete the series. Okay. So with that, it's all laid out there in the standing order, and I want to transition to kind of a brief overview of identifying anaphylaxis, because I know there's a lot of concern about that, and it's good. We should be prepared. And so I think the most important thing, hopefully people can see this document, is to identify folks with that. And that's why you have the observation period. So first, think about it in this way. This may be helpful. Anaphylaxis is highly likely when any one of the following 3 criteria are met. So it's sudden onset of symptoms, minutes to hours, involving the skin, the mucosa within the mouth, or both. So you get hives, you get itching, flushing, swollen lips, tongue, and the back of the throat. And at least one of the following. So you get that, sudden onset, skin, mucosa, and at least one of the following: change in your breathing, cough, kind of you hear that tightening in the throat, that noise, or reduced blood pressure or collapse. So that's the first way to say that is likely anaphylaxis is occurring. The second way to identify anaphylaxis is when 2 or more of the following occur suddenly after exposure to the allergen, or for example, in this case, the vaccine. So it's that sudden skin and mouth changes, change in the respiratory status, change in blood pressure, or sudden GI stomach upset like crampiness, abdominal pain, and vomiting. So for that, it's 2 or more of the following that's likely that anaphylaxis is occurring. Or the third, or all of a sudden that person has a big lowering of their blood pressure, and it's different from adults or kids. Adults, it's blood pressure is less than 90 for the systolic blood pressure, or a 30% decrease from that person's baseline. And then so this is just a quick way to identify those who are having anaphylaxis. And so I wanted to then, there is a standing order and you should all be aware of that. But I also want to just note a quick way of thinking about this. You can see this document. So after you identify the person with anaphylaxis, what do? You're assessing their airway, breathing, and circulation, your basic life support. You give epinephrine. That's the intervention. And traditionally for adults, since you've heard about the dose of 0.3, the newer evidence errs more towards 0.5. So as long as you're giving up to a maximum of 0.5 milligrams in adults, IM into the anterior outer thigh, that's just fine. And you're calling 911. Once you're identifying anaphylaxis, that's a medical emergency, you're giving epinephrine, you're supporting the airway, you're calling 911. And ideally, you as a team are doing that at the same time. One person is stabilizing and giving epinephrine, the other person's activating emergency medical services and calling 911. And so I'll share these 2 documents with you. It's meant to be just a quick way to how to identify it and what do I do. I wanted to provide you that overall context. So again, very rare, but we should be prepared to identify and manage anaphylaxis if it occurs. Okay, well, I hope this helps, and I'll share these documents. Questions, you can always give me a call. All right, thank you.